The Role of Physical Activity for Special Needs Children. Physical Ability by Emily Coffey. Physical activity for children who have a physical disability and or are special needs is similar to that of a normal child. Physical activity is seen as a universal need for all children and includes those with disabilities and special needs. Physical activity is vital in allowing children with pre-existing medical conditions to limit the effects of developing a secondary condition. However, physical activity cannot always prevent the development of these conditions. Children with a disability need to maintain their muscle strength, joint structure, and joint function to allow for the muscles to still be able to complete daily living chores. This can be completed with the help of our health professionals who develop an appropriate plan taking into consideration the child's disability. Children with special needs or who are disabled can work with health professionals to develop programs that assist with weight and strength-based training. Weight-bearing activities can enhance the child's quality of life and decrease the development of medical conditions such as hypertension and coronary artery disease. Mobility is a vital component of a child's movement through everyday life. However, this is different in children with disabilities or special needs. If the disability is one that affects the mobility of the child, such as cerebral palsy, a health professional can help maintain the mobility the child has and try to decrease the risk of a decline. Health professionals can also allow for the specific child to have the appropriate amount of physical activity. Children with disabilities can develop benefits through physical activity. However, special needs children are restricted in their ability to participate, have lower levels of fitness, and have been seen to have higher levels of obesity compared to other children. It is important for parents and health professionals to understand these benefits of physical activity, as they can sometimes overestimate the risks associated or overlook the benefits of physical activity for the child. If a family group is found to have a strong belief in physical activity and cultural activities, it is believed that the child will be involved as well. Parents can have the belief that different environments can be inaccessible, less accommodating, and facilitate less policies regarding the disabled or special needs child. This can result in the lower functional ability of the child and can result in the child being less social and less active in physical participation. Participation in physical activity of a child with special needs or a disability should be regular and should take into consideration the following factors. What does the child want to do? How does the child behave? And what activities will allow them to gain social development? Mental or educational needs. Physical activity participation should involve working with the child themselves, be that disabled or non-disabled, to create the best way to address physical activity and increase the participation of the child. The role of physical activity for special needs children is significant as it allows for a decrease in minimisation in secondary health conditions, increase in social interaction, improvement in joint muscle and overall mobility. By analysing the above articles, the following recommendations can be observed. Working with a health professional can allow for a child to develop an appropriate physical activity schedule, which is targeted to the needs of the individual child and takes into consideration this child's specific needs. Physical activity can be a vital part of the development of any child's motor ability and function and can possibly decrease the severity of a physical disability.